actually born in the hospital a half century ago this year. Throughout my life growing up here in Pembroke, had occasion to come into the hospital for various childhood issues and bumps and scrapes. Also had association with the hospital through my father, who was not only the auditor here for many years, but also was on the board of directors. So, I've always known, and the hospital was a big part of my life. And I guess my father's affiliation with the hospital was in large part responsible for my choosing the field of health administration. I guess in the back of my mind was the notion that I'd be able someday to come back to my hometown and work in a hospital such as this one. And dreams do come true. The hospital is a special place. It's not only a special place for me, as I've indicated, but I suggest that it's a special place for everyone that lives in and around our community. And unless you had occasion to use the services of the hospital, you might not appreciate that. Ours is still small enough to be a friendly place. It's really neighbors caring for neighbors, and I see that all the time with my staff in various areas of the hospital have personal connections often with the patients that we see in the facility. That adds a special dimension that you don't see in a large tertiary hospital in the big city. But we're able to marry that friendliness and that closeness with a very sophisticated healthcare environment. Our services and our technology is second to none in all areas of our hospital, from our maternity area, which has been redeveloped recently, to our emergency department, which is essentially brand new and has technology that affords us to be a regional stroke center, for instance. The general hospital has its roots back in the late 1800s, where the Grey Sisters were asked to come to this community by the community leaders of the day to help to tend to the sick and marginalized. And in those days, it was a very small lumbering community without any services. And the thing to do in those days was to get a charitable group to come and set up what was known to be a hospital at the time. A small, couple of room house usually was converted into a hospital, and it was a place to receive care, and without a lot of technology or advanced medicine. And over the years, that has evolved and grown, and we've seen hospitals emerge that were more modern facilities for their time. And also the community leaders in the early 1900s also caused to have formed a civic hospital. And our two hospitals worked in concert with one another for many years until the mid-1990s, where it was determined by a government commission that the two hospitals should come together to create the mass and the capacity to advance into the next century of medicine. And that's what we've seen. We've seen the coming together of the talent, really, from the two hospitals into a single facility. Now the Pembroke Regional Hospital, that's large enough and vibrant enough to meet today's needs.
The CT scanner is, and the expert staff that we have running this piece of equipment is incredible. And it's so nice to be able to do surgery on people where you actually know what the problem is. And because of the improved imaging through CT scanning, and subsequently with nuclear scanning, it's improved the practice of medicine immensely in this community. We did end up with rehabilitation, which is an amazing service. And the recovery from someone who's had what appears to be a debilitating stroke, and see how they change over a 2-week period to accept and improve their way to live in a community is amazing. I mean, it's an incredible service. But now with the development of these programs throughout the area together, coupled with the computerization and the transmission of this information back and forth, we're getting more into the one-stop treatment. So where the patient has the test is becoming less significant as to where or how we can get access to these tests and use them, obviously, to treat the patient.
The technology that we have is also very broad in scope. In our diagnostic imaging area, for instance, we have ultrasound and X-ray, which are typical of most hospitals, but we also have nuclear medicine capability and with a SPEC CT camera, so a nuclear medicine camera with a CT as part of its technology. We also have a CT scanner, and we're actually enjoying the benefits of a brand new CT scanner. So we're on our second generation of scanner, and we went from old first generation technology, a 4-slice scanner, to a 256 slice scanner. So we've actually leapfrogged a couple of generations and have the most state-of-the-art CT available, which affords us additional opportunities to do testing that we haven't been able to do before. So virtual colonography, and we're about to initiate some new cardiac imaging services with that new technology. We're opening 4 brand new operating room theaters with state-of-the-art capability for minimally invasive surgery and for telemetry, both within the rooms and with an ability to communicate with specialists for consultation in Ottawa directly from our operating room theaters. Those new theaters are being housed in a new building that came up in our front parking lot off McKay Street, and the hospital is actually leasing on a long-term basis the 3rd floor of that building, which connects through a glass link with our 3rd floor surgical program.
I was with a wonderful group of people, and as I look back on my career and I look back on my experience at the hospital, I really think that I speak for all of the graduates of the Lorrain School of Nursing when I say that we owe a tremendous debt of gratitude to the Pembroke General Hospital, now the Pembroke Regional Hospital, and the Grey Sisters for having the insight and the wisdom to pioneer nursing education here in Pembroke. They've always had nurses here, they've always trained nurses here, and certainly I was involved in planning a lot of the student placements, and we had great cooperation all the time, all of my career. We never had any problem getting clinical experiences at the hospital. The people were more than willing to give us whatever we needed to develop the nurses that we were trying to prepare.
We are formally a teaching site of the university, which means there's oversight from them into the actual curriculum that we're teaching here, and we have some very clear objectives that are set out for the residency program as a whole, both here in Pembroke and the Ottawa sites, to make sure that the residents get exposure to all the things that they need to learn in order to pass their final exams, which they write at the end of the 2nd year. Our residents go to Ottawa once a month for a full day of academic sit-down teaching along with the other residents that are in the Ottawa program. And there's also a lot of support for us as staff physicians in terms of faculty development, educational sessions for us. and input into any changes that might be made in the curriculum, and always every year looking ahead at if we're going to have more trainees next year, that whole process of interviewing and establishing that ongoing. There are a number of other family doctors in the community as well who also have the residents working with them in their offices. Primarily Dr. Joan Tyler and Dr. Lori Mowick, who are very involved in nursing home work in this community and have a great interest in geriatric medicine. They've taken our residents under their wing to teach them that particular skill set, which is a very valuable one in both the demographics of this area and generally with the way the population is aging. The hospital has been supportive of this program right since day one, and when I first discussed it with Pierre and Noel that we were talking with Ottawa about, could we set this up here, the support from the administration side of the hospital has been wholehearted from day one, and and that's been just made things so much easier for us and made this, and I think all the residents and all the trainees we've had have always felt very welcome in the building, both from all the staff, and that leads to a good atmosphere to be working in.
I like to look to the future. I like to look at the new young individuals, the young nurses, the young physicians we're getting, and the enthusiasm and the support that these individuals are getting, and the welcoming that we are doing as a community to bring them in and make them part of the whole picture. The community has always been supportive of the hospital. It always has, and it's always come to bat in terms of. Not just in terms of giving money, but in terms of volunteers and in terms of the whole aspect of recruiting physicians. I mean, the community wants good health care, and the pinion or I guess flagpole or signpost of good health care is our healthcare institution, is our hospital. There are procedures and approaches to diseases now that I'm doing that we didn't even dream of 30 years ago. There are operations that I'm doing now, or operations that I did 30 years ago that I haven't done for 20 years. And that is because of the technological and moral support of the hospital in saying, yeah, let's keep up, let's offer our community the best possible service we can.
We evolve with the times, we evolve with technology, and we're always looking ahead as to how we can better serve our community. And there are some types of care that through technology and through the evolution of healthcare, we couldn't have imagined providing in a small community in earlier times, and now that's become very possible. We're also looking at acquiring a MRI, a magnetic resonance imaging machine, as the next large diagnostic modality that we currently don't have. We expect to have that in the near future, and securing the talent really needed to deliver that care. And a hospital is dependent on technology and the buildings, but it's really about people and about their dedication and skill. And we have an exceptional group of people caring for people in our community, neighbors really caring for neighbors, but they're world class. We have people with world class training in all areas, and our reputation is sound, and it's based on the high quality of care that's delivered by the people that work here. We have the best of both worlds. We have a small community hospital environment which allows a warmer, more personal touch, neighbor to neighbor, but we also have a facility that's state-of-the-art that delivers high quality, world-class care. So what more could you ask for than that?